So prostate is a gland. Gland is a small organ that produce fluid. So the main, the prostate is found under the bladder. So
Okay.
in the deep pelvis. So after the bladder, there is a prostate. After this, the urethra. So urine is go from bladder through the prostate until it come out through the urethra. So it produce fluid is important to for give nutrition to the sperm and to increase the volume of the semen fluid.
Seminal fluid.
Yeah, so seminal fluid is mainly composed of the prostatic.
Jom sama-sama podcast An-Nur penuh makna. Kasih dan ilmu kita sebarkan untuk semua insan.
Selamat datang ke podcast Apa Kes yang dibawa khas oleh Hospital Pakar An-Nur. Hari ini sedikit istimewa kepada pendengar-pendengar dan penonton-penonton. Saya akan menjalankan sesi ini dalam bahasa English. Because with me today is our very new latest resident to join us all the way from Egypt via Malaysia, of course. Our new urologist, Mr. Omar. Mr. Omar, thank you so much for spending a bit of your time. Thank you for being with us on this day. To our listeners and watchers, can you please introduce yourself? Who are you? How did you make it all the way here? And of course, I'm sure the listeners are very, very interested to know about you. And also, can you please explain what interested you to do medicine and also specifically what interested you to get into urology?
Okay. First of all, I would like to thank you very much for the opportunity to appear in this podcast.
You're welcome.
And for all the people who are hearing us now. I am Omar Ahmed, Fahmy Ahmed. I'm 44 years old, originally from Egypt. So I finished my Master of Urology and training in Egypt almost about 16 years ago.
16 years.
Yeah.
Wow.
So in 2014, I went to Germany to do a fellowship in urology for 2.5
Where in
years.
Germany specifically?
In Tübingen. This is a very big hospital specified in treating of cancer. Mainly.
wow,
Yeah,
okay.
cancer cases of urology for kidney, for prostate, for bladder. So I spent there 2.5 years.
Okay.
Had more experience in robotic surgery and laparoscopic surgery, reconstructive surgery as well.
Wow.
After this, I came to Malaysia in 2016. When I was in Germany, I met my boss in Malaysia, Professor Dato Khairul Asri.
Okay.
So he was doing his fellowship also there, so he brought me to Malaysia. Yeah, so he was head of department in University Putra, Malaysia. So almost 14 years I was working in University Putra, Malaysia, neurology department. Then very recently, last month only, I joined Hospital Pakar An-Nur as
Welcome to
a
An-Nur.
resident urologist.
Welcome to the family.
Thank you. So I chose medicine because from very early I would like to be a surgeon. But surgery, a lot of specialty, general surgery, neurosurgery, orthopedic, whatsoever. Why urology specifically? Because some kind of surgeries they might impact the quality of life of surgeon because very stressful, have to go for a lot of calls, trauma cases.
Oh, yes.
So for urology, it's have, we can say, more balanced life because emergency is not that very common. Plus, it also very related to technology. Every time you can see more advance in technology and the surgery. Even nowadays, most of our surgery is done by endoscopic surgery,
Yes,
by
of
laser.
course.
Even for robotic surgery, this is the first field to be used. Use a robot is urology.
Really?
More than 25 years ago.
Wow.
So I think urology has for me, it was quite interesting. And after almost 19 years in urology, I think it was alhamdulillah, it was a tawfiq and a good decision for me to choose to be a urologist.
Oh, of course, of course. All grace to God. Without Him, where are we? So, by doing urology, by specializing in urology, you get a nice balance of life.
That's what I feel.
You feel.
Still a surgeon, but still have the balance of life.
So to those future urologists out there watching and listening, you get the best of both worlds. But many people still are unfamiliar with the specialization of urology. They think urology means that the doctor only treats the prostate and of course stones.
Yeah.
So Mr. Omar, for our watchers and listeners, could you please explain what is urology? What do they treat? What are the warning signs that should a person watch out for before, and when they should seek a urologist? And also, how important is the early screening when it comes to diseases and conditions associated with urology, Mr. Omar?
Okay. I agree with you. Many people don't know exactly what urology is for. So basically, urology is related to two systems in our body. One is the urinary system, which is composed of the kidney, ureter, bladder, and urethra. This is for excretion of the urine from our body. This is present in male and female.
Okay.
So urologists treat male and female,
female
for
as well.
urology conditions. Plus, we also treat the genital and reproductive system of the male. So this only for male, which is composed of the prostate, of the testis, and penis as well. So for urology, urinary system, we treat male and female. For genital system, we only treat male patients.
Okay.
Okay. Regarding the, you mentioned the warning signs or the symptoms. Some conditions, present with some symptoms that patient might notice. For example, blood in urine. Our urine normally there is no blood; it's clear or it's faint yellow in color. But some patients, if they have blood in urine, even if only it shows appear in the urine test only, it not appear in the eye. So this should be investigated, and we could, when there is obvious blood in urine, we call it red flag sign. It's very important to be investigated. Many causes many problems can be behind this. Could be stones, could be infection, even could be cancers. So it's a very serious matter. Also the pain, when patient have pain, lower pain
yes,
at
of
the
course.
area of the kidney, must be investigated to make sure there is no stones. Because sometimes the patient just take painkiller, then after some time the pain will resolve. But the problem is still there. So patient will come again after many years with already damaged kidney because the stone was still there, even he doesn't feel any pain or any symptoms. Other symptoms, especially for elderly people, they might have abnormality in passing urine. For example, the stream of urine become more slow or intermittent, or they have dribbling, or they have to go more frequent to the toilet, especially at night. So all this, this is the common symptoms. Plus also for boys, especially when they have a severe pain in the testis, this could be a very serious condition. We call it testicular torsion. Must be seen immediately by a urologist. Otherwise, it might end up with a catastrophic outcome. Even have to remove the testis if the time is too late. So this is what urology handle.
So urologist actually covers a very wide scope of diseases and conditions.
Yes.
And we'll get into that even more further. Since, you mentioned about the kidney, how important is kidney and genitourinary tract? Because when we talk about this, it's a very personal thing. And many people have the stigma that I'm going to share something intimate, especially the men, with the machoism. Sometimes they are very, I would say shy to talk about their problems. So can you please explain that the kidney stones, kidney health, when should, we seek the urologist? Also, and what kind of investigations, basically what will you do when the patient comes to see you?
Okay. For the investigation part, usually we start with laboratory investigations. We take sample from the urine, sample from blood to check the basic investigations. But some patients, they might require what we call the imaging. Imaging is to see the organ from inside. So this imaging can be ultrasound, can be it can be CT scan, it can be also MRI, especially for prostate. The conditions, like you mentioned, kidney stones. Kidney stones is like a stone. You see in a stone. This stone can be found inside the urinary system. Why? Because the urine is all the waste product from our body goes through the urine. The water plus this. So
Very important
yes.
function, yes.
So this is like kidney causing making a filtration to our body. So a lot of minerals and substances come out with the urine.
Okay.
When the urine is very concentrated, these minerals become start to collect together and form the stones. And slowly it can get bigger and bigger.
We can say concentration.
Yes. So this stone, first it can be asymptomatic at beginning, but if it's block the flow of the urine, especially at the ureter, it can cause severe pain. It also can cause infection. So eventually, if this stone is not treated and causing obstruction, it can end up with damage of the whole kidney because the system, urinary system, is blocked. So the kidney getting more swollen and eventually
Eventually.
it might be damaged.
Even though the other kidney compensates, eventually there will be.
It depends, but even so, if the patient, people can live with one kidney, but still precious kidney because
Of course, yeah.
anything can happen to the other kidney also, or if it's damaged. Sometimes also the stones on both sides, both kidneys. So this eventually can cause renal failure.
A little bit about the myth. Is urine sterile?
In general, yes. There is no bacteria in the urine unless you got infected by like bacteria due to some certain causes or due to anatomical problem or due to stones. Then it can cause urinary tract infection.
And can infections cause stones as well?
Yes. Stones and infection, either each one can cause the other or can result from the other. So recurrent infection can cause stones.
Okay.
So recurrent infection usually due to either anatomical problem or acquired problem when the patient has we call it stricture either in the urethra or due to trauma or due to previous castration or whatsoever. This can form stones. Or the stone itself can cause recurrent urinary tract infection as well.
Wow, okay. Is there anything a person can do to prevent stones from forming? What kind of foods or drinks they can take? And again, we got to touch about the myth. How much of water does a person need a day?
Okay. For how much water? Usually we say about 1 liter for each 27 kilogram from our body weight. So it's not a fixed number. Depend on the body weight and also depend on the activity. If some people, especially who do a lot of sport or activity or they work outdoors in under the sun, so they prone to lose more, sweat more and lose more water, so they have to compensate more. So how we know we are taking enough water from the urine color? If the urine color is very faint yellow or even like very diluted, then it's considered.
Usually we say straw colored, isn't it?
But if very like dark or up to like orange, then meaning is not enough. Is not enough hydrated. This person.
Of course, any colors other than that
Yes.
denotes that the patient should see the urologist.
Yes. And the factors for stone formation is usually we say multifactorial.
Okay.
But of course, number one is inadequate hydration, meaning not enough water people drink. But other factors, dietary factors, because as I mentioned, urine contain minerals. So when we eat certain kind of foods containing more minerals, especially salt, so very salty food, food with high uric acid content, urine content that cause uric acid, like red meat or
sushi, seafood.
Yeah, exactly, especially the
All the
shellfish.
delicious foods.
Yeah, this is the problem. When you
Yes.
talk about this, you get more. Also, obesity is a risk factor for stone formation. Genetic factors sometimes. Some people, they have metabolic conditions like hyperparathyroidism, their calcium for certain reason is high, or they have gout, for example. 20% of patients with gout, they might have stones also. Some anatomical problems or congenital anomalies in the urinary tract, which doesn't make the urine to flow naturally, or causing stasis of urine inside the body longer than the normal time. Yeah, so all these factors can contribute to stone formation. But again, the main factor, or we can say the most important thing, is the proper hydration. When we take enough water, so even with the minerals in the urine, it will be flushed out. Yeah, first before it precipitate inside the.
So like they say, water is the universal lubricant,
Exactly.
a source of life, isn't it?
Yes.
Okay. Just now earlier, Mr. Omar, you mentioned that urologists, they treat both male and females. But when it comes to the genitourinary tract, specifically male only.
Yeah.
And of course, when we talk about that, we got to touch about the prostate. Now, as you know, awareness is increasing and people are getting more educated and more well-read. I think the concern about the safety of and also the health of the prostate is increasing, especially among Malaysian males.
Yeah.
To share a personal note, close family member of mine was lost to prostate cancer, and we found out at a very late stage. So can you please advise our watchers and listeners, what does the prostate do? Why is it important? And how do we actually keep an eye on the prostate so that it does not lead to anything sinister, especially?
Okay. So prostate is a gland. Gland is a small organ that produce fluid. So the main, the prostate is found under the bladder. So in the deep pelvis. So after the bladder, there is a prostate. After this, the urethra. So urine is go from bladder through the prostate until it come out through the urethra. So it produce fluid is important to for give nutrition to the sperm and to increase the volume of the semen fluid.
Seminal fluid.
Yeah. So seminal fluid is mainly composed of the prostatic secretion. Okay. So usually after age of 40 or above, it's got just a matter of aging. It start to increase in size.
Why does that happen?
Yeah, this is no clear explanation about this. However, it's mainly a hormonal issue. Okay, so a lot of theory about this, but eventually, it's, some people they might have their prostate increase in size. Normal prostate size is about 20 grams, but sometimes it can reach up to a few hundred.
Wow.
Yeah.
Okay.
So why it can cause problem? Because as I mentioned, urethra is going through the prostate.
Okay.
So when the prostate enlarge, it will compress on the urethra.
Okay.
So the flow of urine will be affected. So there is a few symptoms that might happen. Just patient might feel obstruction or incomplete voiding or intermittency, meaning when he go to the toilet, the urine doesn't come as smooth as before, or incomplete voiding. Patient after he go to toilet, after 10 minutes, 15 minutes, have to go again to pass urine. Sometimes he has to walk many times at night to pass urine. So all these are signs of enlargement of the prostate. So this enlargement sometimes could be, most of the time is a benign issue, but sometimes it can be malignant as well. Could be prostate cancer. So usually patient or people at age of 50 or more, they should go for at least one time a screening. We call it blood test to see if any is a tumor marker for prostate cancer. If any increase, so they might need further investigation about their prostate.
Serum PSA, am I correct?
Yes. Also, some patients, they might notice abnormality in their urine flow, but as you mentioned, they feel shy to ask for
it's always
consultation. But the problem when this, when this obstruction stay for a long time, first it can affect the kidney. You see, prostate is down, but it can end up with a renal failure.
Whoa.
Yeah, if the urine is not flowing.
Obstructed long enough.
Obstructed, yeah, for a long time. or it can cause bladder failure as well, because bladder keep contracting against pressure, against high pressure. Because bladder is like a pump, so when it keep bumping against high pressure, eventually it might fail as well, and it can cause stones or infection. So this is regarding the prostate. Prostate cancer when it's detected early, it can be cured and treated. Usually, we can do surgery with robotic prostatectomy, or we can do radiotherapy. Sometimes we don't need to treat the patient; we just observe the condition. So all this depends on the final diagnosis of the prostate cancer. But as you mentioned, we have to go for early screening. So when we detect it early, then the chance for curability and maintaining good quality of life is much better compared to come
Later.
too late.
Once, of course, later the cancer was already spread, and it complicates the treatment process, isn't it?
Yes.
Okay. And speaking about men's health and also the genitourinary tract, I think we have to talk about this topic because we, as clinicians, we should be the one who put the foot forward and actually fight against the stigma, fight against the shyness, and try to educate our patients to come forth. So, erectile dysfunction.
Okay.
Can you please explain to our listeners and watchers what is erectile dysfunction, when does it happen, and certain factors which might actually contribute or associate with erectile dysfunction, Mr. Omar?
Okay, we can simply say erectile dysfunction is inability to get or maintain a good erection enough for satisfying sexual intercourse. So this is, to be honest, is common than people think. So I think recent studies showed maybe up to 1 in 3 person and young person, they have
1 in 3%?
Yes, they might have some kind of erectile dysfunction. And it's not a matter of age. People think it's just because of the age, but actually age alone is not the main factor. A lot of factors, because erection is a complex physiological process. It depends on the psychology, on the blood vessel conditions, heart condition, neurological factor as well. So all this contributes to affect the erection. So and the main, the important thing that people need to know is that erection itself, inadequate erection itself can be a sign for another problem, like ischemic heart disease, for example, dyslipidemia with a high cholesterol, diabetes, hypertension. Many of people, they don't know that they have this medical problem, but this problem just present with inadequate erection or erectile dysfunction. But that's why when they come for investigation or asking for treatment, we can detect what is the cause of this. So erectile dysfunction is not purely related to age. It can be, as I mentioned, related to other factors. And nowadays, with we can say sedentary lifestyle, people more lacking to do exercise, a lot of stress.
Things are getting easier.
Yes, yeah, and stress from the, educational parts of the work, economy pressure, all this. So when the people, they have stress, definitely this affects their erection as well. And anxiety, smoking, of course. Smoking now is quite common in young generations. So all this can affect the erection.
Is it a reversible cause?
Yes, definitely. When it's detected early and it's mainly related to lifestyle or this correctable causes, yes, it can be treated, and even it can get improvement when the patient follow a healthy lifestyle, try to lose weight, taking a healthy diet. So even they might feel better erection than compared to before.
Can you share some examples of food or even fruits or supplements that a person might take to actually prevent or treat this erectile dysfunction?
Okay, for supplements, there is no specific something I can recommend, but overall, we can say the healthy lifestyle and avoiding like sugar, fat, and
Processed
carbohydrates.
food, trans
Yes,
fat.
yes. All this, of course, it can affect the erection. So the more healthy lifestyle is better chance to get better erection.
It always comes back to that, isn't it? Healthy lifestyle,
Yes.
good food, proper hydration.
Exactly.
And sometimes speaking about supplements, sometimes people get supplements off the internet, online.
Yeah. This is
I am sure you want to comment about
yes,
that. And how dangerous is that actually?
Okay.
Can you share, Mr. Omar?
First of all, usually, this people who sell this kind of supplement mainly for business, for to make profit. Mainly. Okay, so all this is not tested or tried before in a proper clinical trials. So the problem with this is two things. First, it might be containing just some herbal things that has no effect on the erection at all. So people just lose their money for buying these things.
Ouch.
Another thing, some people put medication inside. So some pharmacogenic agents
Without
like
supervision.
Viagra, without supervision and without telling the patient, because medications must be. Some certain medication are contraindicated for certain people. Like, for example, we can treat erectile dysfunction with Viagra or Cialis, but certain people they cannot take it because
Yeah,
it's
of
dangerous.
course.
But if they buy this supplement and it contains this medicine, but they don't know, then they take it, it can cause, put them in danger by taking these drugs without knowing that it contains these drugs.
I think
So
they,
I think, it's, any treatment must be in a proper way by prescription by a specialist who know exactly what is the cause and he know how to treat.
take that to heart, watchers and listeners. Always come back to us. Consult with us. Let us know. That will save you and your pocket. Can you share what kind of exercises usually we see online? You know, everybody's got their channels and you can see online. What kind of exercises you can do to actually prevent, I've read about that. And is that true? That you can prevent erectile dysfunction, certain exercises, Mr. Omar?
You mean exercise related to erectile dysfunction?
Yes.
Okay. Some people they say Kegel exercise. Yeah. So it's we can say it can help because it can improve the blood circulation in the pelvis or
okay.
in the body. But again, it's not only this. Like if someone his lifestyle is not good, smoking, have diabetes or this. So by doing Kegel exercise, he will not improve 100%.
So it should be wholesome, the treatment. It should be from all angles, all avenues. They can get looking at all factors.
Yes.
So we've talked about a lot about men's health, genitourinary tract stones, and erectile dysfunction. I think we also helped dispel a few myths today. Mr. Omar, if you have a take-home message, what would you like to tell our watchers and listeners today?
Well, I think, as we mentioned at the beginning, early consultation and sharing the symptoms with the doctor is always better than coming too late, because when we detect the disease early, we can treat it and we have a higher chance for curability compared to coming too late.
And one last thing before we go, Mr. Omar, this is special for our watchers and listeners. Can you say something in Malay for them?
Ya, boleh. In fact, saya boleh cakap bahasa Melayu.
Oh, wow.
Kalau nak datang kepada Hospital Bakar An-Nur untuk consultation, biasanya saya menjalankan consultation dalam bahasa Melayu. So, tak ada masalah kalau tak boleh cakap bahasa Inggeris. Memang boleh datang dan kami boleh bincang dalam bahasa Melayu.
Oh, wow. Nice. So, pendengar-pendengar dan penonton-penonton kita, Mr. Omar bukan saja fasih berbahasa Arab, dia boleh juga bercakap dalam bahasa Inggeris dan bahasa Melayu. So untuk mendapatkan konsultasi
Sebelum ni bahasa Jerman juga.
bahasa Jerman juga, wow. Dengar tu pendengar-pendengar dan penonton-penonton kita. So untuk mendapatkan konsultasi dan juga perundingan dengan Mr. Omar, untuk segala soalan dan juga query-query anda tentang subjek urologi. Jangan lupa mendapatkan info di laman web kami dan juga di media-media sosial kami. Linknya adalah di bawah. And to end, untuk mengakhiri, saya ingin mengucapkan terima kasih kepada Mr. Omar kerana meluangkan masa. Saya tahu Mr. Omar sangat sibuk. Dan juga terima kasih kerana sudi memberi pandangan dan juga nasihat dan juga jawapan-jawapan kepada soalan-soalan saya tadi. Terima kasih sekali lagi Mr. Omar.
Terima kasih banyak.
Dan jangan lupa bersama dengan kami dalam siri yang akan datang, podcast Apa Kes yang dibawa khas oleh Hospital Pakar An-Nur. Sekian, terima kasih.